Okay, so if you're in early pregnancy, I'm willing to bet you've had that moment. You know, that little twinge or ache that makes your heart skip a beat, and you immediately think, wait, is everything okay? It is a huge source of anxiety. So, in this explainer, we're going to untangle all of that. We're going to sort out what's normal, what's not, and really help you understand what your body is trying to tell you. Let's dive in. This is the million-dollar question, isn't it? You're so excited, you're hopeful, and then you feel that familiar crampy sensation. And just like that, your mind starts racing. It can be so unsettling. So let's get some real clarity on this right now. And you know what? Before we even get into all the science and the details, can we just get one thing out on the table? Cramps suck, period. Whether it's for your period or in pregnancy, they are just not fun. It just seems kind of unfair, doesn't it? To feel pain for something that's totally normal. Okay, now that we're all on the same page about that, let's figure out what's actually going on in there. All right, let's tackle the fear head on. Why does that crampy feeling send us right into a spiral of worry? Well, it actually boils down to a mental shortcut that we've been learning our entire lives. First us, just so we're all talking about the same thing, this is it. It's that feeling of pressure or maybe a dull ache deep in your lower pelvis. It might pop up and then disappear, or it could hang around for a bit. It's a very specific feeling, right? So here it is, the mental shortcut. For most of our lives, cramping meant one thing: your period is coming. And when you're pregnant, the idea of a period showing up, well, that feels like something is very wrong. It's a completely understandable leap in logic. Your brain is just following the rules it's always known. But here's the really good news. That shortcut, as understandable as it is, just isn't accurate in early pregnancy. It's like the rules of the game have changed. There are a whole bunch of other perfectly normal reasons you might be feeling crampy. So we've got to learn the new rules. Now, let's try to paint a totally different picture. Let's reframe this feeling. Instead of a warning sign, let's think of it as, well, a side effect of the incredible, amazing work your body is doing right now. The simple truth is, your uterus is basically a construction zone. It's going through this massive renovation to build the perfect, safest, most nurturing home for your baby. And, construction can get a little noisy. You're going to feel some of the work being done. And here's the why behind those construction noises. Your uterine lining is getting thicker and cushier. Blood flow is ramping up like crazy to bring in all the good stuff: oxygen, nutrients. Hormones are making your uterine muscle more active, and the whole organ is literally expanding and stretching. All of these things, all of these good things, can cause that mild, achy, crampy feeling. It's a sign of progress. Ah, yes, this is another really common one that causes a ton of anxiety. A lot of people notice some cramping after sex, and their minds immediately jump to, oh no, did I do something to hurt the pregnancy? Let's be crystal clear on this one. In a normal, low-risk pregnancy, sex does not cause a miscarriage. Full stop. It's true that orgasms can cause some temporary uterine contractions, which, feel like cramps, but they're usually pretty mild and they fade after a little while. That baby is tucked away, safe and sound in there, very well protected. Okay, let's zoom out for a second. Because guess what? Not every single crampy feeling in your pelvis is actually coming from your uterus. There are a couple of other usual suspects that are super common in early pregnancy. So over on the left, you've got the uterine cramps we've been talking about. But check out the right side, your intestines. Those lovely pregnancy hormones are famous for slowing down your whole digestive system. This can lead to gas and bloating, which can create pressure and aches that feel almost exactly like uterine cramping. Another really common cause is a urinary tract infection, or a UTI. It helps to remember that your bladder and your uterus are literally next-door neighbors. So if your bladder is irritated and unhappy because of an infection, that discomfort can easily feel like it's coming from your uterus. The good news here is that a UTI usually brings along some friends, some other very distinct symptoms. So look for things like burning when you pee, feeling like you have to go all the time. Maybe your urine looks a little cloudy or off color, or you have a fever. If you have those symptoms, that's your cue. That's a clear signal to call your doctor, because UTIs are easily treatable. Okay, now we do need to talk about the more serious stuff. And I'm not bringing this up to scare you, I promise. I'm bringing it up to empower you. Knowing the difference helps you know when to relax and when it's time to get checked out. And the most important thing to remember is this: it's not about one single symptom. It's all about the pattern. This right here is the core message of this whole thing.
You are looking for a shift, a change. Is that mild on and off feeling from yesterday suddenly behaving differently today? Is it getting worse? Is it escalating? That change in behavior is what really, really matters. This chart does a fantastic job of laying out the different patterns. With a miscarriage, you typically see the pain and bleeding progressing together. They both get stronger and heavier over time. Now, for an ectopic pregnancy, the pain is often, but not always, on one side, and it can get very sharp. You might also have other strange symptoms like dizziness or even pain in your shoulder, and that can happen even with very light bleeding. See how the patterns are really distinct?
So let's just say it one more time because it's the most important takeaway. The key feature you're watching for is progression. Are the cramps getting stronger? Is the bleeding getting heavier? If both things are actively getting worse, that is a pattern that absolutely means you should call your doctor or midwife.
And this is so, so important. The goal of all this information isn't for you to sit at home and try to diagnose yourself. Nope. There is only one person who should be doing that, and that's your medical provider.
Your job is so much simpler and way more manageable. Your job is just to be an expert observer of your own body, to notice the feelings, and more importantly, to recognize the patterns. That's all.
So here's your action plan, broken down into 4 simple steps. 1. Notice, what do the cramps actually feel like? Are they mild or are they getting stronger? 2. Observe. Is there any bleeding? Is it changing? 3. Recognize. Are any other symptoms popping up, like feeling dizzy or feverish? And 4, the most important one, communicate. When in doubt, just make the call. That's what they're there for.
Hopefully, this has helped you learn how to tell the difference between a simple sensation and a potential signal. By understanding these patterns, you can start to trade some of that anxiety for knowledge. So I'll just leave you with this question. What's one less thing you have to worry about today?